what we do for our patients with all sclerodermas, we're doing echoes on these patients. We are doing, in a limited patient, would I always do a CT scan all the time? Probably not. I'm more kind of thinking about the echoes, thing like that. But of course, if they, all of a sudden develop worsening shortness of breath, I'm going to kind of do the workout. Or if I hear, of course, respiratory capsules. So as you can see here, some of the same medicines, that I mentioned before, but mycophenolate is a lot of times what we put these patients on. It can also kind of help with some of the skin stuff. I've seen that with the Selenomab as well. But like I said, avoid glucocorticoids if you can. Now, the limited ones, we don't really worry so much about the scleroderma renal crisis because they don't really have those RNA polymerase. And have I seen, diffuse patients on steroids? Yes, I have. I mean, you have to understand, we treat the disease manifestation. Every single scleroderma patient that I have, I tell them, we treat what we're up against. If you start getting ulcers to your fingers, we have to improve your blood flow there, right? Like we put people on, all of my scleroderma patients are on like a calcium channel or an ARB, or sometimes we have them on sildenafil if it's pretty bad. I mean, so we treat what we're up against and we make sure that we stay on top of it. So, that's scleroderma in a nutshell. We could literally do a whole thing on scleroderma, but obviously you guys see that a lot associated with your ILDs.